You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, two things, mommy makeovers and the keys to a natural looking facelift. With us, we have the go-to plastic surgeon in the desert, Dr. Zakhireh. Dr. Zakhireh, welcome back to the program.
Thank you, good to be here.
Now, we were talking about this before we went on. We had you on the show about, more than 10 years ago, like almost 15 years ago, you were first on the show. And I looked at the tape and we both look about 25 years younger and it was only 15 years ago. So at any rate, so for people that don't know your practice, and I know you brought a lot of photos of the mommy makeover and some of the facelift, but for people that don't know your practice, I mean, who's a typical patient and what are the different services you offer?
Being in the desert, the average age is 64, 65. But what we're noticing is that there's definitely younger and younger people coming in because everyone is paying attention to how they're aging and whether their skin looks healthy. It used to be that, if you were going to go to a wedding or a special occasion, you would go and get your hair done and get your makeup done. Now, patients come in and they want to have a facial, they want to have Botox, or they want to have laser. There's less downtime with the new lasers, and we're actually combining the lasers with platelet-rich plasma, or PRP. And it's amazing because you apply the platelet-rich plasma and then you do the lasering, which actually embeds the PRP into the skin. And then after the lasering, you put on another layer of PRP, and the healing or downtime has been cut literally from 7 to 10 days down to 36 or 48 hours.
That's nice.
It's amazing, and the skin quality of the patients is just that much better. It's really amazing. Another improvement in our technique with fat grafting, for example, has been that we are able to break down the fat now with different size filters. We're able to break down the fat and make the fat into smaller and smaller particles, so that the fat is now liquid. So we can inject the fat into the finer lines, let's say in the lips, or crepey areas in the lower neck and the décolleté area, or if you have, for example, crow's feet or laugh lines, what we call, even in the forehead. So it's really beautiful, and also in the back of the hand. So you're not only rejuvenating that area with volume, but it's really important because when you break the fat down and liquefy it, it releases the stem cells, and the stem cells stimulate more blood supply production into that area, and literally the skin is younger. You're literally reversing time, which is pretty amazing. It's really fascinating, the things that are going on in medicine nowadays.
I mean, what's changed since I first met you? More than 15 years ago, I think is when I first met you. What's happened?
Well, I mean, honestly, I'm so excited about this. I could talk about it all day long. We're going to have to come back on a second show, literally. Yeah. But so the laser technology has improved. The lasers are now treating much more specifically. Therefore, they don't have to treat so hot, as hot as they used to be, so that there's less thermal damage. So the downtime has been cut by, let's say if a laser before took 3 months to heal, now it takes 3 weeks, 2 to 3 weeks. Or if we go even lower on the laser or combine it with PRP, it takes 2 to 3 days. So it's amazing. And the quality of the laser is such that it still does a great job, actually better than the older lasers. And
so the results are better than ever.
Oh, absolutely.
Like when I first met you, and even 20 years ago, because the show's been out for 20 years, the plastic surgeons were only doing surgery, and they were poo-pooing, lasers and things like that. You weren't, but you kind of saw it coming. So
Correct.
Is it very common if you do a facelift on somebody, you're always doing a combination of procedures, maybe fractionated laser, PRP, some of the tightening procedures, things like that?
Yes, absolutely. So, first of all, I tell my patients, I'm very honest with them. I say, I'm a surgeon and I love to do surgery, but if I can do something conservatively for you without putting a scar on you, then I would rather go down that road. Or if I can do something that's minimally invasive, so do a smaller surgery so you heal up faster, I would definitely rather do that for you. There's no reason.
Does that happen where people come into your practice and say, Dr. Zakhireh, I need a facelift? Mm-hmm. And you say, maybe not.
Correct, yes. So for example, somebody will say, you know what, I need a facelift. So say, okay, you know what, the quality of your skin is really good. Yes, you got a little bit of fat in your neck. And so I can liposuction the fat, I can liposuction the jowls, we can redefine your jawline with liposuction or with some fillers even. I can, put fat here for you. So instead of your face looking like this now, it can look like this and, restore this for you. So if they don't have to, go through the downtime of, let's say 1 month, instead of, 1 month, you can do it in 1 week, then why not? Yeah. But, the secret to it is I need to make sure that they get really, really good results, that they feel that their money's worth has been achieved. Everybody works really hard nowadays. And so, I feel that I need to be respectful because their money's very valuable. But at the same time, they want to look good within the workforce. They want to look good for their friends and family. There's a lot of patients that come in and they tell me, I don't want to be in pictures anymore. I shy away from pictures. I shy away from social events. I don't even like to look at myself in the mirror anymore. Wow. So there's different issues. And then also in the workplace, there's a lot of people that are, still very healthy, and they just feel like maybe their face and neck is sagging a little bit, so they could use a pick-me-up to make them more competitive, whether they're in outside sales or just within the company. If they want to go up in the ranks, all sorts of different.
Because there's no doubt about it. As an employer, if you're looking at two candidates, one looks absolutely exhausted, yeah, one looks fresh and ready to go. Mm-hmm. You can't help but, like the person that looks like they have more energy, more enthusiasm. And that's with all things being equal. One person looks absolutely exhausted, one looks fresh. Who do you hire? Absolutely.
And, I think we've talked about this before, Randy, where they have done studies where they show babies a picture of an older person or a younger person. The baby picks the younger person. They show the baby a picture of a less attractive or more attractive person. They pick the more attractive person. So it's really interesting because it's within our genes, to sort of automatically, I hate to say it, but maybe pass judgment, and so you're absolutely right. And it's not something that we tend to be politically correct in the workforce and things like that, but absolutely, when people show up, they need to look fresh and they need to look rejuvenated and more energetic.
Now, people tend to put things off, right? So, for example, you've been on TV for a long time in the desert. Mm-hmm. Do you have people that say, I've been watching you for 10 or 15 years and I finally decided to do something? Do you get some of that?
Absolutely. I get that every day that I see patients. What a lot of people go through is they're either emotionally not ready, or life just keeps happening to them and they don't have downtime. But at the same time, I tell the patients, what, it is, what you say is true, but for whatever reason, now you're here, the time is right, and you're emotionally ready. So if it takes you that much time and energy to come in and see me, you are here now for a reason.
Okay.
And you're motivated, so let's take care of you. Let's give you, that, I call it a second chance. I remember I was taking stitches out from behind the ears of a lady that I had done a facelift on. And she started telling me about how when she looks in the mirror now, she sees herself from 25 years ago. And she had had such a rough 25 years, and she said, you know, I made a lot of mistakes, and, you know, now I have gone back to 25 years ago, and I feel like I can go back and do things over again, and I have a second chance, and I can rectify a lot of issues in my life. And as she's telling me this, she's crying. You know, she started crying to the point where I was so touched that I got teared up, and I started crying, you know, and I was, you know, trying to hide it, but then she just really touched me. It was very inspirational.
So are there a lot of people, I'm sure there are, but I mean, there's a lot of people that are bothered by their looks that in certain cases could be a quick fix. Mm-hmm. I mean, you meet these people. Mm-hmm. I mean, would you say that people are like miserable for 5 years with their appearance before they actually do something about it, or even longer?
Yeah, I'm talking longer. I'm talking 20, 30 years. And it's really interesting because a lot of times when I do their treatment, whether it be fat grafting, laser, facelift, you know, whatever, liposuction, they always say, gosh, why didn't I do this, you know, 20 years ago? My life would have been totally different. Because, you know, it's really interesting because when you do, especially a facelift or liposuction tummy tuck, we have the privilege of observing that patient from before, when they come in for the consult, to after their surgery.
Yeah.
Their personality blossoms. They're smiling a lot more. Their hairstyle changes. Their makeup style changes, and they start dressing.
It's like they're back.
Oh yeah, and they start dressing contemporary, and it just, you know, honestly, Randy, I'm getting goosebumps just telling you this.
Good,
you know,
good.
half the time I don't realize what I do for people, and yeah, it's just really nice to be able to tell you this and recall all of these emotions that the patients feel.
You know, I was telling you in the green room that, you know, I interviewed Bosley, you know, the hair guys. Mm-hmm. And, you know, they tell me, you know, guy gets his hair back and he's at Machu Picchu, he's taking selfies. It's like a new lease on life. He's swimming and dating and hunting and fishing.
Absolutely.
And the same could be said, and we talk about this, when you take care of something that bothers you, mm-hmm. whether it's your nose, your ears, whatever, or mm-hmm. abdomen, the lipo, that it's like a big deal for these people.
Correct. And, you know, you're absolutely right when you say the selfie at Machu Picchu, because I do see some of the patients on social media, and definitely they are so much more alive, and they're committed to their life. They're smiling, and they're just having a good time, you know, and that's that's what it's all about. You know, at the end of the day, we have these precious moments in our life, and it's all about doing what you can to just grasp that moment and enjoy it.
A lot of people know you because of your results, and I have to compliment you there. Do you get recognized on the street? Because you've been, you know.
I do, but what I've noticed, you know, as the years kind of pass by, I honestly tend to shy away from kind of being noticed or patients making a fuss. But you know what? I've been at restaurants plenty of times, and patients come up to me, they say hi, they hug me, they say, "Oh my God, you've changed my life."
Well, that's
you know?
nice.
I was at our favorite sushi place one night, and we have boys' night, and so with my guy friends, we're sitting there having sushi, and this beautiful, attractive lady walks in, and I mean, she's the kind of person that turns heads when she walks into a room, and my friends were like, "Wow, look at her!" And as soon as she saw me, she walks up to me and she gave me a hug, and she showed me her tummy. She was like, "I'm so proud of my belly button, and look at how flat, look at how muscular." And I was mortified. I was turning red and purple and all sorts of colors. And I was like, thank you, you're so kind. And then she walks away, and all my friends look at me, they go, "Really?" You know, one of them is infectious diseases doctor, one of them is a dentist. They're like, "I look in people's mouths all day, and, you know, I deal with infections, and this is what you deal with? You're so lucky." And I'm like, yeah.
So a lot of people look in the mirror, and we talked about it in the green room, and they don't like what they see. Mm-hmm. But when they look in the mirror and like what they see, it's like the inner charisma, the inner smile comes out, and it's like they become who they used to be.
Absolutely.
Right? It's like they're back.
Absolutely.
And you see that.
Oh yeah, and and again, Randy, we've talked about this. I have a very personal story about this. My own mother, when she started aging, her soft tissues of her cheeks were so full and heavy, they fell and they weighed down the corners of her mouth. So she looked sad. So when she looked in the mirror, she looked sad. Therefore, she acted sad, and she stopped telling jokes. She started acting older. And it literally took me probably 12 months to talk her into getting a facelift. She was just so scared. And I did facelift, liposuction of the neck. I did a little bit of fat to her lips, did a little bit of fat to her eyes, and I did upper blephs where I took the excess skin off. And then, the cool thing about it is that when I went back into her wedding album, she didn't look as young as she was at her wedding album, but she had that look again. And so after she healed, she became so much more youthful, smiling again, and telling jokes. In my hands, what I tend to do is I make my incisions. A lot of doctors make their incisions straight. I curve my incisions with the natural anatomic lines or the natural creases or wrinkles. And the other thing I pay attention to is the earlobes. When you inset the earlobes, a lot of surgeons sew the earlobe down all the way, and I sew the earlobe down at its root. That way the earlobe looks like a normal, dangling earlobe. So that the patient doesn't end up with pixie ears. That's what
So it's called?
that's called.
Okay.
So it's really amazing when done well, and when the patient looks like themselves. They show up to a party or function, and or they're I've had patients at the grocery store.
Yeah.
And somebody walks up to them, a random person that they don't know. They go, "God, your face and your skin looks so beautiful and healthy," and that just makes them light up. It just makes their day, Or they go to a party or a function, and people come up to them and say, "You look so beautiful," and they don't look like they've had anything done.
They don't look done.
That's
Is
the
that
key.
a fear, like on these consults? Let's pick women for a moment. Woman in her 50s comes in.
Mm-hmm.
Is that like part of the conversation? I don't want to look done. Do they say that?
It is invariably the first thing that they say. And a lot of times what happens is, when you look done or you look pulled or you get that wind-blown look, as they describe it, it's because the surgeon didn't take pride in what they do and they took shortcuts.
Well, there's art to this, right?
Absolutely.
I mean, behind the scenes, some guys are probably cut out for this, and some guys aren't. There's like,
Correct.
what, 60, 70% art and the rest science?
Correct. Absolutely. I would say, even 80% art. But what happens is, you're absolutely right, because there are surgeons out there, which I call cookie cutter surgeons, and they just kind of have an algorithm and they go by that algorithm. But with the human body, you just can't do that. We're living, breathing tissue. Everything's dynamic. You're dealing with skin, muscles, cartilage, bone. So you have to tailor every surgery for every patient.
Okay, good.
Honestly, I love it, but that's the hardest part of doing a facelift. After a facelift, I did a facelift yesterday, and I'm emotionally done. I leave it all on the table, because during a facelift, I have to make anywhere from 300 to 400 independent decisions on each side of the face, as far as
How come you never told me this until now?
Randy, you're inspiring me, and But
okay, so I'm sorry to interrupt.
yeah,
So it's a lot of work.
Yeah,
a lot of mental work.
The angle of the incision, the angle of the tightening of the stitch, how tight you place the stitch, where you place the stitch, what kind of
But that
stitch
comes from
you
experience,
place.
right? Your facelifts of today have to be so much better than they were 20 years ago.
Correct. And honestly, Randy, 20 years ago, I was, I look back at my results 20 years ago, I was really good. But, you know, it's an evolution. And I would only hope that each and every surgeon pays attention to their results and they keep growing.
Look, I've had a plastic surgeon tell me this. He said, it was an old timer. And we were on a plane and he said, Randy, he goes, facelifting is like golf. Like you can be a great golfer, but if you don't golf for 6 months or you only golf once a month, you're only going to be so good. He goes, facelifting, you have to do it all the time. Ask your surgeon, how often do you do this?
Correct.
Do you do it all the time? And I mean, you have the luxury of doing a facelift all the time.
Correct.
Do you believe that though, by the way, that there's like a rhythm to it?
Absolutely. And I actually, you know, after each and every procedure that I do, I go and I take meticulous notes on what I did differently and how it turned out. And that way I have notes to go back to see, you know, how things turned out. So, you know, I essentially do 4 surgeries, faces, breasts, liposuction, and tummy tucks. And everybody always asks me, which one is your favorite procedure? I'm like, that's like asking me which one of your 4 kids is your favorite kid.
Yeah.
So what happens is if I don't do one procedure for like a week or 10 days, I literally say, oh, I miss doing facelifts. What's going on? And sometimes
people don't know this. Most guys are doing like 1 facelift a month, a facelift, maybe 2 facelifts a year.
Correct.
I mean, that's the average surgeon. I mean, you're doing a lot of these.
Yeah, I mean, on any given week, we do anywhere from 1 to 4 facelifts a week. But, you know, what I find out is that things change with seasons. You know, let's say you got spring and summer coming, so patients want to come in for liposuction, breast work. That way they look good in their bikini. But then, you know, sort of towards the
end of the year,
winter and fall and things like that, they want to come in and do a lot more facelift, fat grafting to the face, erbium laser, and things like that.
Okay, good. Now we're going to have to, you know, we're short on time already.
I know.
So we're going to have to go through these photos. You brought a lot of photos. Let's take a look. We'll start with the mommy makeover stuff.
Sure, absolutely. Well, you know, Randy, before we do the mommy makeover, if you don't mind, I want to tell you, these are the cases that I look at, and I see that I am inspired.
So you said.
Because
what do you mean by that?
Well, so everybody thinks plastic surgery or cosmetic surgery is skin deep, but you know, if you can kind of get beyond that and look at the person, you're physiologically making them healthier and you're emotionally making them healthier, and that's really, really important. So, for example, the first case I want to run by you is, you know, our nurse in the operating room, her husband approached me and he said, you know, I just feel unhealthy and I feel sluggish and I'm stuck at this point in my life and I want to do something. Would you be willing to do liposuction on me? I said, absolutely. He said, well, you know, I have a pretty big stomach. Do you think any of my skin is gonna sag? I said, no, you're a young guy, early 30s, and olive-skinned, he's Hispanic, and I think you'll be fine. So I started doing liposuction on his back, and I was shocked. To my surprise, he ended up having 5 liters of fat on his back.
Is that a lot?
That's a lot.
Okay.
So you're talking about 5 bottles of soda or 5 1-liter bottles of shampoo.
Oh, okay.
So,
wow.
You know, and safety reasons, I stop at 5 liters. So that could be dangerous. So, you know, I ended up liposuctioning the back, put him in compression garment. He came back a month later and we liposuctioned the front, and it totally changed his life because so not only did he not go to the gym or anything, it's just that his body was chiseled, and we brought out the muscle. We literally sculpted him, and he ended up being so motivated. He ate healthy, he stopped drinking beer, he started going to the gym, and he went back to school. And to me, that is touching someone's life in a positive aspect and in a positive way. I'll tell you a funny story about this because so one day our nurse came to the operating room and she was laughing her head off. Apparently her neighbors had thought that she had left her husband, or they were separated, and she had gotten a new boyfriend who was younger and in shape. And they were like, well, we don't want to. Well, we hate to ask, but what happened? She's like, what are you talking about? And so it was hilarious, and that makes me feel good, because that's the ultimate ultimate compliment.
So no matter what it is, I mean, look, you take somebody that's in their 60s and you give them a 10-year reversal as far as the appearance of their age. Somebody that hates their abdomen, you flatten it out. It's like it gives them the leverage to what? Start eating better, taking better care of themselves. They become more optimistic. It's like they're back in the game.
Right, and they don't have to. They don't have to even push it. They don't have to, talk themselves into it. It just happens. They are just being that new person. And it's funny that you say that, because so one of the facelift pictures that I'm going to show you is from one of our caregivers who would take care of her and her sister would take care of our facelift and tummy tuck patients the night of surgery. So she came to me, she said, Dr. Mo, I am so, impressed by you, and I want to let you know that I've decided that when I'm going to retire, I want to come in and have a facelift with you. I said, okay, thank you, I'm honored. And so sure enough, when she announced her retirement, within a month after that, she came in and had a facelift with me. Now, with that said, her and her husband are very active. They're very active cyclists. I'm talking about road cycling, really serious people. Very active at hiking and swimming, just all sorts of stuff.
So they went back to all that stuff?
Oh, well, they never stopped, Okay. But she came back, she goes, I don't know what it is, but I just feel like my hiking's gotten better. I'm doing better at cycling, and, that's what it's all about. Why? Because you look in the mirror, you're younger. Literally, you're younger.
All right.
And, and the good thing about it is you look like this, and then literally 6 hours later, you're somebody new.
Nice.
It's just that quick of an evolution.
And we're short on time. So we're going to do a part 2. I'm going to have you back. We'll do another at least half hour, and we'll go over those photos.
I knew this was going to happen. I knew it.
You knew it, so you should have told me then, Dr. Zakhireh. Okay, we're going to take a quick break. We come back, and we'll get to those photos. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.